All right, let's jump right in. Today, we're covering the incredible story of the hepatitis C virus. It's a journey from what was essentially a lifelong chronic disease to a condition that is now curable. And really, it's one of modern medicine's greatest triumphs. Just so you know, this explainer was compiled using a Gemini deep search, and you can find a detailed list of all our sources in the linked Notebook LM document. Okay, let's get into it. And that right there, that's the headline. The speed of this therapeutic revolution is just astonishing. For all of us, our colleagues in the lab and in the clinic, managing hepatitis C virus today is a completely different world than it was even a short time ago. The entire paradigm has shifted. We've gone from chronic management to active cure.
This quote just captures the essence of it perfectly. This wasn't just some small incremental improvement. It was a fundamental change in what was even possible for patients. But to really appreciate why this leap was so huge, we've got to understand the virus itself and figure out why it was such a difficult opponent for so long.
So what was its secret? What made this pathogen so good at setting up shop and causing these chronic infections? Well, as a member of the Flaviviridae family, hepatitis C virus has always been notoriously hard to study. For years, it just resisted being grown in standard cell lines. We only achieved robust replication pretty recently, and only in specific human hepatoma cell lines like Hus7. That elusiveness in the lab was a huge hint. It told us this thing was sophisticated, a true master of stealth.
And the key to its stealth is this really unique structure called a Lipoviroparticle. Now, this is not your typical virion. Think of the hepatitis C virus particle as a sophisticated hybrid. It literally hijacks the host's own lipids and proteins to build itself, and that is absolutely central to its success as a pathogen.
And this just illustrates the strategy perfectly. It's brilliant, really. By cloaking itself in host apolipoproteins like ApoE, the virus puts on a disguise. It makes itself look like a normal low-density lipoprotein. This lets it waltz right into liver cells using the host's own lipoprotein receptors. And crucially, this lipid shield physically blocks our antibodies from ever reaching their targets on the viral surface. It's a near-perfect system for hiding from the immune system.
So, you've got this virus that has successfully evaded the immune system and set up a chronic infection. What happens next? What are the long-term consequences? This is exactly why finding a cure was so critical. The stakes for patients with untreated chronic hepatitis C virus were just incredibly high.
The disease follows this relentless, almost linear progression. The virus hangs around, causing chronic inflammation in the liver. That inflammation, in turn, drives fibrosis, which is the buildup of scar tissue. Over decades, this leads to cirrhosis, which is severe, irreversible scarring that just fundamentally disrupts how the liver works. And the final, dreaded step in this pathway is hepatocellular carcinoma, or liver cancer.
And just let that number sink in for a minute. For a patient who already had cirrhosis, the risk of developing liver cancer was 1 to 4% every single year. Here in the Netherlands, this made hepatitis C virus a leading cause of both liver cancer and the need for liver transplantation. That was the stark clinical reality everyone was fighting against.
But then, this bleak picture started to change. We hit a turning point. The development of what we call direct-acting antivirals, or DAAs, completely rewrote the story of hepatitis C virus. It moved us out of that difficult interferon era and into the age of the cure.
This comparison says it all, doesn't it? It's night and day. The old interferon-based therapies, they had low cure rates, serious toxicity that made many patients feel absolutely awful, and they took a year or even more to complete. Then came the DAA revolution. All oral regimens that are incredibly well tolerated, last just 8 to 12 weeks, and, this is the most important part, achieve a sustained virological response, which is a definitive cure in over 95% of patients. It's really hard to overstate how transformative this was.
So today, the approach is clear, it's standardized. Here in the Netherlands, the HCV Richtschnur gives us that evidence-based framework, and the good news is it's fully aligned with the global consensus from bodies like the WHO. The exclusive standard of care is these all-oral DAA regimens. The specific drug choice is tailored to the patient based on things like viral genotype, but the outcome is consistently a cure in a matter of weeks. And for kids, there are special considerations, of course, focusing on adapted dosing and formulations to make sure it's safe and effective for them, too.
Okay, so with these amazing drugs in hand, where does the medical microbiology lab fit in today? Well, our role is absolutely central. In this new test and treat world, the lab is an indispensable partner. We provide the critical data needed to guide these curative therapies.
What we do now is provide an essential molecular profile. We use RT-PCR to confirm there's an active infection, and then, crucially, to confirm the cure by measuring that sustained virologic response. We do the genotyping to help select the perfect DAA cocktail, and in those rare cases of treatment failure, sequencing helps us detect any resistance-associated substitutions, usually in an NS3 protease or NS5B polymerase regions. And while actual phenotypic susceptibility testing is still largely a research tool, that genetic data is vital for guiding what to do next.
So, the crucial point is this. The modern management of hepatitis C virus is a partnership. The miracle of these drugs is enabled by the precision of the diagnostics we provide. Our work in the lab gives clinicians the roadmap they need to navigate to a cure for nearly every single patient.
With a cure for individual patients now a reality, the goal has become even more ambitious. The whole conversation has shifted from just treatment to something bigger, elimination, the complete removal of hepatitis C virus as a public health threat.
And this is the objective we're all working towards, right here in the Netherlands and all around the world. The World Health Organization's goal to eliminate viral hepatitis by 2030 is audacious, for sure, but it's now scientifically feasible precisely because we have the tools to cure the infection.
Of course, curing existing infections is only half the battle. Prevention is the other key piece of the puzzle. This involves really robust public health measures, continued screening of the blood supply, harm reduction strategies for high-risk groups, and the critical work of the GGD, the municipal health services, in coordinating testing and linking people to the care they need to get cured.
And this is the question that I think really defines the next chapter for the hepatitis C virus. We've largely solved the virological and the pharmacological challenges. We know the virus can be beaten. So the final hurdle isn't in the lab anymore, it's one of public health and logistics. How do we design the systems to find, test, and link to care every single person living with this virus to make elimination a reality?
And that's our look at the hepatitis C virus revolution. It's a truly remarkable story of scientific progress. Please subscribe for more deep dives into the world of medical microbiology. We'd love to hear your thoughts and questions in the comments below. Thanks for joining us for this explainer.